Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, in the previous video we discussed questions from midwifery section, and here in this video we can see questions from community health nursing, and we will see the questions. First question: one of the following disease has been eradicated globally as declared by WHO. And our options we can see: first option poliomyelitis, option B human monkeypox, option C pox virus, and option D smallpox. Here question is: which disease has been eradicated globally as declared by WHO? And the correct answer is option D. Smallpox is eradicated globally by WHO. And WHO declared global eradication of smallpox in May 1980. The year is also important. Okay, 1980. Here answer is option D. Question number 2. Which of the following disease is not transmitted by airborne droplet? And the options are option A measles, option B chickenpox, option C poliomyelitis, and option D tuberculosis. Here the correct answer is option C poliomyelitis. The disease which is not transmitted by airborne droplet is poliomyelitis. This poliomyelitis is transmitted by mainly by fecal-oral route, and the incubation period of this poliomyelitis is 7 to 14 days. That is also important point. Question number 3. Which of the following vaccine is not included in open vial policy? And our options are option A OPV, option B DPT, option C BCG, option D TT, that is tetanus toxoid. Here correct answer is option C. BCG is a vaccine which is not included in open vial policy. So we have to know what is open vial policy. This open vial policy means once the vaccine vial is opened, we can keep the vaccine up to 28 days in refrigerator. Okay, so that is known as open vial policy. Once we started to use the vial, we can keep and we can use up to 28 days. Okay, this open vial policy started in 1997. The year is important, 1997. And the vaccine which is included in the open vial policy is TT, DPT, pentavalent vaccine, OPV vaccine, IPV vaccine. Here in our option, BCG is not included in open vial policy. Question number 4. Anti-malaria month is. And options are option A January, option B May, option C June, option D August. Here correct answer is option C. June is the anti-malaria month. And if anti-malaria week they ask means answer is May. Anti-malaria week is May and anti-malaria month is June. It is also important. Question number 5. In India, which is the first referral unit? And options are option A sub-center, option B primary health centers, option C community health center, and option D district hospital. The first referral unit in India is option C. Community health centers is the first referral unit. Okay, so from PHC they refer to community health centers. That is the first referral unit. Second referral unit means to community health centers, it is district hospitals. Okay, first referral unit is community health centers. And the next question number 6. Question number 6. What is the aim of Swajal Dhara Yojana? And our options are option A provide safe drinking water, option B promote institutional delivery, option C interlinking of Referral project, and option D none of this. And here correct answer is option A provide safe drinking water. Question is aim of Swajal Dhara Yojana, and this project was started in 2018. The year is important, 2018. Okay, here option A is the correct answer. Question number 7. Which of the following disease leaves scar for lifetime? And our options are option A chickenpox, option B smallpox, option C measles, option D BCG. Our question is which one of the following disease leaves scar for lifetime or permanent scar. Okay, scar in the body. And correct answer is option B smallpox is the correct answer. And the next question. Question number 8. Smallpox eradication program was launched by WHO in the year. Options are option A 1967, option B 1977, option C 1975 and option D 1970. Here correct answer is option A 1967. The smallpox eradication program was launched by WHO. Question number 9. WHO declared that the smallpox was eradicated from the world in the year. And options are option A 1967, option B 1977, option C 1980 and option D 1970. Here correct answer is option C. In 1980, WHO declared that smallpox was eradicated from the world. Okay, and the date is 8th May 1980. 8th May. Okay, and the previous question was smallpox eradication program launched by WHO in the year 1967 and eradicated by 1980. Question number 10. BCG vaccine was first introduced in the year. And options are 1910, option B 1921, option C 1927 and option D 1970. Okay, so BCG vaccine was introduced in 1921. Option B is the correct answer. And the next question, question number 11. National Immunization Day is. Options are option A Tuesday, option B Wednesday, option C Thursday, option D Saturday. And the correct answer is option B Wednesday is considered as National Immunization Day. And the next question. Question number 12. Who discovered HIV? And options are option A Louis Pasteur, option B Linus Pauling, option C Luc Montagnier and option D Rodin. And the correct answer for this question is option C Luc Montagnier, who discovered HIV virus. And the next question, question number 13. First case of AIDS was reported in India in the year. Options are option A 1972, option B 1983, option C 1986 and option D 1980. And the correct answer for this question is option C 1986. The first case of AIDS was reported in India in the year 1986. Question number 14. Following are the bacterial disease except. And options are option A cholera, option B typhoid, option C amoebiasis and option D TB. Here correct answer is option C. Amoebiasis is not a bacterial disease. It is a parasitic disease which is caused by Endomoeba histolytica. Okay, and remaining cholera, typhoid and TB are bacterial disease. Cholera is caused by Vibrio cholerae and typhoid is caused by Salmonella typhi and TB is caused by Mycobacterium tuberculosis. TB or tuberculosis. Question number 15. Following are mosquito-borne diseases except. Options are option A JE, option B dengue fever, option C filariasis and option D oral sore. Here correct answer is option D. Oral sore is not a mosquito-borne disease. Remaining Japanese encephalitis, dengue fever and filariasis all are mosquito-borne disease. But oral sore is not a mosquito-borne disease. It is one of the oral ulcer.